Hello and welcome to our Friday webinar. We are on with Dr. Stephanie Lamb. Welcome, Dr. Lamb.
Hi.
Oh, and I'll just sneak peek. So today's topic is, this is really interesting. We have not done this in any way, shape, or form before, I don't think. We're going to talk about wild birds and how they might affect our pet birds. And I know that's not a wild bird behind you, but do you want to introduce us, since that is not a royal who we're used to seeing, or marine? So who do we have today?
This is Ema, my blue and gold macaw, and even though she is not wild, she did come into a wildlife center. So I actually got her because whoever previously had her, I don't know, she got away from them in some way and was just walking down the street in August in Arizona, which is a little hot. And somebody found her and picked her up and took her. They didn't know what to do with her. So they took her to a wildlife center where I volunteer. And that's how she started living with me after that, because clearly she was not wildlife and did not need to be in the wildlife center.
Wow. What are the chances that a macaw walks into a wildlife center that you happen to be volunteering at? Like, that's just right. And that's a brave person, because not everyone who, especially not used to parrots or big parrots, are going to go and like want to pick up a macaw, a blue gold too. So
Right.
right person, right time, right place. So that's how we
guess.
here. All right. Okay, so do we have a lot of, I know you have a wonderful PowerPoint to present. You all, your PowerPoints. That I hope people go back and rewatch our webinars, because the PowerPoints alone are just like, it's like Cliff Notes. It's like, it just guides you through it too. So just a lot of information to digest, and then you can go back and revisit it with Dr. Lamb's wonderful PowerPoint. So I highly encourage you to do that. All right, let's see. All right, let's get, yeah, I can't wait to see this topic, because I interact with the wild birds outside all the time, feeding them and stuff, but I'm just curious, if I'm bringing anything inside or what I'm doing here. So, all right, I'm going to let you get started. And then if you have a question, we'll try to do it at the end of the webinar. But you will use the Q&A feature, not the chat feature, for any questions you might have. And Dr. Lamb, I'm going to let you take it away. Got a lot of ground to cover.
I'll go ahead and share my screen and we'll get started with our PowerPoint here.
There we go.
So yes, as you had alluded to, we're going to be talking about wildlife today, but really in relation to how it affects how wildlife could interact with our parrots, because it is a common question that I do get of, can I take my bird outside? Is it safe for my bird to go outside? If my bird is outside, do I need to worry about them being around wild birds? Or on the flip side, sometimes people don't ask, and then they'll come in and they'll be like, yeah, I took my bird outside and, it was hanging out with some other birds that flew down, some pigeons flew down and were hanging out with my bird, and my bird got a little nervous about it, but it was really cute, and so sometimes it comes from either sides of like, people being really cautious and maybe being too afraid to take their birds outside, or being a little too lax and having their birds around wild birds when maybe they shouldn't. So we're going to go over wildlife stuff and things that we might need to be aware of with our parrots, and whether or not we need to worry about certain diseases. So just a slide here of various pictures of me doing stuff with wild birds. So as you guys know, I work at a private practice that is an exotics animal hospital. So I get to see birds, and I work with parrots as, probably the main bird species that I work with. However, I also volunteer at a wildlife center. So I'm usually at the office 4 days a week, but I'm at the wildlife center 1 day a week. Or sometimes more, depending upon what's going on, working with wildlife. And the wildlife center where I work mostly with birds. It's called Liberty Wildlife, and its major focus is birds. There's a little bit of other wildlife too that is seen there, but mainly focuses on birds. So these are just some pictures of patients that I've seen there or things I've dealt with. This is a picture of just a little baby barn owl, and I'm putting a splint or taking a splint off of his leg. Actually, we're doing a change of a splint. He had a fracture of that limb. This is a eagle that was actually getting a transfusion because it was anemic. Down here, this is actually a radiograph of a Canada goose who you can see has a fracture of the radius and ulna bone, and you can see how traumatic that type of injury is. But then here's a post-op radiograph showing that we were able to get those bones in appropriate alignment. Sadly, this goose was actually hit by a golfer, like at a place where people golf. Someone hit it with their golf club and broke its wing. So, you know, we fixed the wing, and then there was also some education that needed to go into how you should not hurt wildlife with golf clubs. But that, I mean, stuff like that happens, and it's always an education event. So, you know, something just to be aware of. This guy, a lot of times at wildlife centers, I think sometimes people think like, oh, we're working just with these like big majestic birds, but this is just a cute tiny little baby. It's a chipping sparrow, and he's still like a little baby, so he's tiny. And he actually had just had surgery. He's waking up from surgery in this picture here. He had to have a little limb amputation, and amazingly, some of the tiny little guys can lose a limb and be able to be released and do just fine out there in the wild. This is just a picture of a juvenile bald eagle. He's not in his complete like adult feathering yet. I think he was 3 years old when we released him. He had a fracture of one of his legs, and we were able to set it and release it. And so it's just me with a gigantic smile on my face, because it's really exciting to get to release an animal that you have helped rehabilitate. These couple of pictures up here are of a little tiny baby condor, a California condor. So the facility where I work, we do get to help a little bit with the California condor population that's in Arizona. And this story is actually published in Audubon. I forget exactly when they published this in Audubon. This happened within the last year. But we had to deal with an outbreak of highly pathogenic avian influenza, which is one of the diseases we are going to talk about. So we'll get to that later. But we had to deal with that outbreak in the California condors and the Arizona population last springtime. And out of that came, unfortunately, one condor passed away with influenza, a mother condor that had laid an egg before she got influenza. And the biologists who monitor the condor populations actually went out and collected the egg. The father was still laying on the egg, and they wanted to get the father out of this environment where he was laying on the egg, because he wasn't eating or feeding himself in any way. They were worried also that he could potentially be in this sort of dank cave that could potentially have influenza in it, because his mate had influenza. And so they went in and pulled the egg, also thinking the egg would not actually be viable, so that the father really could go and relieve himself from his nesting duties. He was such a good parent. He was sitting in there for quite a while without eating on his own. So they brought the egg to us, and we hatched out this little baby. And it was actually a year ago today. So, or not today, a year ago yesterday. So yesterday was her birthday. This is little baby condor. I mean, in this photo here, she was like, I don't know, hatched out of the egg for like 5 minutes. So you can see how big they are when they come out of the egg. And then this is a picture down here where I'm in like the suit that makes it so like she's, you know, not around people and doesn't recognize me as a human. And we were doing some testing before we had sent her to be with her foster parents. And we were swabbing her for influenza at this stage to make sure that she herself did not have avian influenza when we sent her off to go be with her foster parents. And then this last photo that I have up in the corner here, this is a little pigeon. And I put the pigeon up because, you know, pigeons are wildlife. And sometimes I think people forget that pigeons need care too. And it is okay and acceptable to take a pigeon to a wildlife facility if the wildlife facility accepts them. But we do absolutely take care of all different species that are out there. No discrimination against the species, and do what we can to take care of anybody who's ill coming in. So lots of interesting stuff happening in wildlife avian medicine as well. But now we're going to get into how does it affect our parrots. So really the big thing that we have to be cautious and mindful of when we have pet parrots is could any of these infectious, could there be anything that they could get from a wild bird? And really the big thing is going to be anything infectious. You know, I'm not worried about many things that can happen to, you know, like trauma, right? Usually when trauma is happening to a wild bird, it's not problem for our parrots. It's really the infectious diseases that wild birds could have that they could potentially transmit to our pet parrots. And when we think about infectious diseases, there's 4 main infectious groups out there: bacteria, parasites, fungal organisms, and viral infections. So we're going to go into a few different ones in all those categories that could potentially be a problem for our pet parrots, and what do we do to try to avoid there being any issues. Okay, so in the bacteria category, there is Mycoplasma and chlamydia are a couple of the infectious agents that are out there in the wild that our pet birds could pick up. Now, there's plenty of others. Mycoplasma and chlamydia are just 2 of like thousands and thousands of different types of bacteria that are out there in the world. It's just that these are ones that are more classically seen with birds that could, in theory, transmit from a wild bird to a pet parrot. And we actually talked about mycoplasma the last time I talked with you guys when we were talking about finches, because finches are sort of the classical bird that we see mycoplasma in. Now, mycoplasma can happen in many, many different species. It's just when we think about wildlife, finches are like the top one that we think about that can have mycoplasma. And what it does is it causes conjunctivitis in finches and other birds. And what is conjunctivitis? It's like inflammation in the conjunctiva, which is like the pink part in your eye. And so basically it initially starts off with just inflammation, redness, maybe a little mucus or excess tearing that happens, as you can see in this first photo here, where this bird, like you can't see a lot of inflammation, but you can notice that there's like this mucus buildup at that lower eyelid. But then as it progresses, you really start to see the inflammation that occurs there. And it becomes this kind of big, gross, red swelling. And then as it gets even worse, look how it's all around this poor bird's eye with time. You know, you can see it slowly kind of progressing up to the upper lid here. But then at this stage, lower down here, it's really affecting all around that eye. So it's just like conjunctivitis in us. I mean, I'm sure most people on this webinar at some point in their life have had pink eye, which is conjunctivitis, and you know, it's not really comfortable. It's often maybe a little itchy or irritated or swollen. It just kind of hurts. You don't feel great with it. You can't see great with it, and it can also progress to affecting the sinuses, causing respiratory infections. So the way that we diagnose this particular disease, because when I see this conjunctivitis going on, I can't say for certain that this is mycoplasma. There's other organisms that could potentially cause this type of swelling. So we can do like a PCR swab. We take like a little swab of like this mucus that's right here. That'd be a perfect sample, or like swabbing this big red swelling there. And we send the sample off to a lab where they do DNA testing and they look for evidence of this organism. Now, the good news is there's antibiotics for this, so we can treat it. Now, unfortunately, in wild birds, because wild birds aren't necessarily checking themselves into a hospital, they can die from this. This is something that can be fatal. Because of the fact that it progresses from just a conjunctivitis to be in the sinuses, to cause a lot of mucus and swelling, and that just really can take a lot out of them. You know, they can be really lethargic, maybe not able to get to their food, may not feel like they want to eat, even if they have access to their food, and then they can just succumb to the disease that way. Now, when our parrots get it, it does the same thing. Our parrots can get this, initially like mucoid kind of discharge, swelling around the eye, and it can progress to affect their sinuses and cause upper respiratory infections. And if a parrot does get it, again, the good news is because our parrots are owned by us humans, we can take them into the veterinary hospital, they can test for this, and they can get them on antibiotics appropriately to treat this type of infection. One of the problems is sometimes it can become chronic. So the frustrating thing about mycoplasma is it is something that has the potential to not go away with one round of antibiotics. Sometimes it takes multiple rounds of antibiotics, and sometimes you can have individuals that get more into like a carrier state where they are harboring the organism and have the potential to be kind of doing okay, not having problems, but could shed the organism and spread it to other individuals, or have like flare-ups of it later on down the road. So, the question becomes, how can we avoid having our birds, get something like this? Again, because finches are kind of the most common species that we see having mycoplasma. The simplest thing is don't have your parrots around any finches. And the reality is most finches aren't going to want to be hopping around and hanging out with parrots. But if you have like an outdoor aviary situation, one of the things that's important is to try to limit finches and small birds like this from getting into that outdoor aviary. There's netting that you can put up around an outdoor aviary that's kind of like thinner mesh that, still allows appropriate light coming into that aviary, but makes it so maybe these little tiny guys aren't able to get in. Or the type of like paneling, wire paneling maybe is small enough mesh that these guys can't get in. And sometimes even like double paneling to aviaries so that like there is a little bit of a gap, like you have two different layers essentially. So like the inner layer is what the parrots have access to, the outer layer of caging is what a wild bird could come up against, but then making sure it's small enough that nobody can get inside. If you do take your parrots outside but don't have like an outdoor aviary, just don't put your birds near any bird feeders or like bird water stations. Like if you happen to be somebody who does feed wild birds or provide a bird bath for wild birds, just don't have your parrots near those things. Don't have your parrots sit down on them. It's not cute. They should have completely separate places to go. I mean, I'm a person who feeds wild birds, and I take my birds outside a lot. I don't have outdoor aviaries, but I have actually like netting in my backyard that's like up encompassing like half of my backyard, so I can have my birds out in the backyard. And my parrots go in the backyard, but my bird feeders and my bird bath that I have are out in the front yard where my parrots are not hanging out and really going ever. If, birds, because these wild birds are, landing on things, and if you have birds landing on stuff, maybe close to where your birds are, making sure that, you're hosing things off and just keeping areas clean, not having any bird poop or anything like that around that they could have access to. Okay, chlamydia is also something that wild birds can carry. And actually chlamydia is kind of more well known about in the parrots than it is in our wild species. But there's like so many different species that have actually been identified as being able to get chlamydia. And there's different types of chlamydia. The main one we think about in our psittacine birds is chlamydia psittaci, but there's a chlamydia buteo, I believe is the genus species name, one that's more in raptors. So it's something that lots of different, if you're a bird, you can get chlamydia. And actually, if you're a person, you can get chlamydia too. This particular version, because it is a respiratory illness. And like if a bird has chlamydia and it sneezes and it has like, chlamydia in aerosolized droplets that it sneezes out, and you're a person, you're standing next to it, you could get chlamydia that way from a bird. So now, It doesn't just cause respiratory signs, it can also cause more serious problems in birds. It can lead to liver problems, and it can lead to neurologic disorders as well. The majority of the time, it's going to be more respiratory signs that people are going to encounter and see, but those other things are possibilities as like the disease can progress and cause more problems. It is something that as well, if we are concerned, if someone brings a bird in to me that they're concerned that's having respiratory signs, I might be recommending that we do a chlamydia test to see if they have this particular organism. And it too, just like the mycoplasma with the picture that we were seeing with the finches causing conjunctivitis, it can cause conjunctivitis in other species of birds and our pet parrots, certainly. So if a bird comes in with respiratory signs, conjunctivitis, or if I do have a bird that has liver problems or sometimes neurologic problems, then yeah, I may want to be testing them for chlamydia. It's a good thing to screen for as well in our pet parrots. Like if anytime somebody brings a new bird into the home, I'm generally recommending that we just screen for this, make sure that nobody's a carrier of this, because it is zoonotic. There's that word down there at the bottom, zoonotic, meaning that people can pick it up from them. And again, this version of chlamydia, chlamydia psittaci, is one that causes respiratory problems in people. Again, the good news is there is appropriate antibiotics. We can get them on usually tetracycline antibiotics, like doxycycline is something that can be used to treat chlamydia. They have to be on it for an appropriate length of treatment. It's something that's not like a short course. It is a more prolonged course of therapy. The reason I put a picture of a little lovebird here is because in Arizona, again, where I live, we have a lot of wild lovebirds, and in different parts of the world, really, there are sometimes parrots that are wild, that are not in places where they're meant to be. And in Arizona in particular, we have a pretty stable population of the peach-faced lovebird out here. Which is really amazing, because you think about, how hot it gets, and oftentimes people are thinking, oh, parrots can't deal with that, but they absolutely can. And a lot of them, like when I see them outside, are living in palm trees, like in the pieces of the dead palm along the sides of the trunk, like hanging out in between dead palm fronds. But that being said, here in Arizona, our population of these peach-faced lovebirds that are wild at this point. I've heard other people call them naturalized citizens at this stage, that they're not originally from here, but they are doing just fine, and so now they're naturalized to us. But they do, in our population here in Arizona, they do get chlamydia, and we have, from year to year, we have problems with chlamydia in these guys, and it waxes and wanes. So one of my interns at the hospital where I work a few years ago actually came with me to the wildlife center, and she tested a whole bunch of the little lovebirds that were coming in, and found a certain percentage of them were coming in with chlamydia. And unfortunately, chlamydia, if left untreated, it can progress and they can die from this as well. Thankfully, there's antibiotics. Yes, we can treat it, but these birds need to come in for us to actually get them on get the appropriate diagnosis and get them on the appropriate treatments. And so sadly, some of the ones out here in Arizona, there'll be die-offs sometimes where people are unfortunately seeing, dead lovebirds because they're dying from chlamydia. We do also see it in doves and pigeons. And like I was saying, there's a version that's in the raptors. And so again, our pet parrots, we need to be mindful that these sorts of infectious diseases are out there in the environment. And just like we talked about with the mycoplasma, you don't really want your pet parrot to necessarily have direct access to a location where other birds are. And for anybody who lives somewhere where there are wild parrots, that are either meant to be there or not meant to be there, just be mindful of the fact that you probably shouldn't have your parrot interacting with any wild parrots. Okay, so those were just the two bacterial things I wanted to talk about. Again, there's tons of different types of bacterial organisms that are out there, and 2 does not encompass everything, but those are ones that are specific to birds that you could potentially see. So now let's go into just a couple of parasitic disorders. The 2 parasitic disorders I wanted to talk about were trichomoniasis and sarcocystis. This little bird here is not what I'm so worried about having either of those things. It's just a cute picture. It's a flycatcher. I don't remember specifically what type of flycatcher it is. There's lots of different flycatchers. But this bird had eaten something inappropriately and had to have surgery. Okay, so trichomoniasis. I put up a picture of a pigeon for this one because this particular organism is a common organism that's actually found in the pigeon's crop. And so just as an anatomy reminder, the crop is a dilation of the esophagus, kind of right at the base of the neck. So in this picture here, kind of right about this region of the bird, where when they eat food, food goes into that crop first, and it'll sit there and just kind of move around a little bit, and then it goes down into the lower portions of the GI tract, the proventriculus and ventriculus. But this particular organism is found in the crop of some pigeons. And I think it really kind of varies based on where you live as to like how common it is. It is a parasite, and when it's in really low numbers in pigeons, it really can sometimes just sit there and not do anything. As long as the pigeon has an appropriately functioning immune system, or doves are another one that it's commonly seen in. If they have an appropriately functioning immune system, then they may harbor very low numbers and do fine with it. But sometimes they get overwhelming amounts of it. The way that it's often spread is it's spread in like standing bodies of water. So like if you have a bird bath that you put out for birds, when a pigeon goes and lands on the bird bath and gets a drink of water, or a dove lands and drinks water, if they have this organism, they have the potential to like regurgitate a little bit and like have organism go into that bird bath, and now you have this parasite hanging out in the bird bath. And then when another bird comes and lands and drinks, they can pick it up that way and it gets transmitted to them. Or the way that it's often transmitted as well, just sort of naturally, is from parents to babies, because when a parent is feeding a baby bird, what are they doing? They're regurgitating food to their offspring, and maybe transferring some of the organism that way. So if a bird gets overwhelming amounts of it, because say it had drank from a bird bath that had a lot of trichomoniasis in it, they get an overwhelming amount, it could turn into infection. Or if their immune system is suppressed for some reason, maybe they've got an infection from something else, maybe they've been through a traumatic event, maybe it's just lack of resources in the environment, maybe it's been really hot or cold, or like just environmental extremes could potentially cause them to be stressed, become immunosuppressed, and things can overgrow. And when it does, it causes like lesions in the crop. They may initially show signs of like regurgitation, but then it can like cause like plaques sort of to develop in the crop itself that can get into the oral cavity, and you can see these actually awful plaques in the oral cavity. It can work its way up into the sinuses, and they can get nasty sinus infections. In baby pigeons, it actually can like cause abscesses in the GI tract, and it can actually go to like the liver. I mean, it can be pretty nasty. Usually the first signs a bird is showing is going to be regurgitation-like signs. The way that we diagnose it is we take a swab from the crop and we look at it underneath the microscope, and we look for the organism itself. Again, the good news is there is a antiparasitic medication for trichomoniasis, so it is a treatable thing, but of course we need to be able to diagnose it. And sadly, when it comes to our wildlife, sometimes these birds are not checking themselves into the hospital, and they can pass in the wild, or by the time that they're really showing signs of a problem, sometimes they might be really sick and debilitated, and that's when we're actually able to capture them and get them into a wildlife facility. Now, how do we have to worry about this with our pet parrots? I have to say, though it is something that people sometimes talk about being able to be given to a parrot, I've personally never seen a parrot with trichomoniasis, which is good. But the reason I really wanted to bring it up is because since we know that it can be transmitted in water, in bird baths, if we have a pigeon or a dove who's more likely to be asymptomatic carrier of it, if they land somewhere and they're drinking water from a location, you do not want your pet parrot drinking from that water where a pigeon or a dove has been drinking from, because that's where they're likely to be picking it up from. If you happen to be a person who also maybe has pigeons and doves and parrots, that's great. But it would be good for you to have your, birds, a pigeon and dove, like have a crop swab and just have it checked out by a vet to say, hey, is this individual a carrier or not, to make sure, you know infectious disease status, and you can treat it if you do have a bird that happens to have that organism. So with this one rule of thumb, don't let your parrots drink from water that wild birds have had access to. Okay, the next parasitic organism that I wanted to talk about is Sarcocystis. Sarcocystis is kind of an interesting organism, and it has, well, any parasite really, they have unique life cycles of how they sustain their life as a parasite, because parasites are living organisms, right? So they have goals, I guess, like any other living organism, to stay alive. And so we often, when we're learning about parasites, we want to learn about their life cycle and how is it that they are living to be able to become a parasite, so that we can kind of understand more, where do they come from, what can we do to prevent them from being a parasite for animals, where can we affect their life cycle. So Sarcocystis, when we're looking at its life cycle, there's a couple of hosts that are involved, and a host is an organism that is harboring this particular parasite. So the first thing is the definitive host. Now, the definitive host for any parasite is the host organism that the parasite really wants to live in, and that it will be able to produce eggs from. It will have the adults and be able to pass eggs out into the environment, because some of these life cycles of different parasites are really complex and involve multiple life stages for the parasite itself. So in this particular parasite, Sarcocystis, this photo I grabbed from a great resource. I have all my photo credits down here for the pictures that I got. So if anybody wants to see this one and know more about it, you can go to one of the photo credits down there. But this is specific for Sarcocystis neurona, which is one that's more of a problem in horses. But I picked it because it was kind of a nice simplistic picture, and honestly, all Sarcocystis species kind of do the same thing. So what happens is we have our definitive host. So again, the one that the adult parasite likes to really live in and allows for them to pass their offspring out into the world, is an opossum. So here's our opossum that the adult parasite is passing out its eggs from. So that egg gets transmitted out into the environment. The parasite's living inside of our possum. The egg is being produced by the parasite. The parasite gets passed out of the possum into the environment. And there's various things that could happen once that egg is passed out into the environment. One thing is it could potentially go to an intermediate host. And the intermediate host is the host that the adult parasite is not passing eggs. Adult parasite is not in, and it's not passing eggs from. So this intermediate host in the particular Sarcocystis that I want to talk about is in cowbirds and grackles, but there's lots of other intermediate hosts that can happen for different Sarcocystis parasites. So your opossum has the parasite, it passes it out in its feces. The grackle or cowbird or wild bird could pick up that egg from the environment, and then the parasite goes into the grackle and actually kind of sits in the grackle in muscle. This is a little picture of the parasite hanging out in the muscle of this grackle. What needs to then happen is either this grackle needs to be predated on by the definitive host. So like the definitive host grabs the grackle, eats it, and then the parasite completes its life cycle into the definitive host to be passing the eggs out in the environment again and starting the cycle over. Or when this grackle gets older and passes away, it has some of these organisms hanging out in its muscle, and it's just sort of quiescent phase waiting for someone to come eat it. When the grackle dies, the possum scavenges it, finds it out there and goes, hey, I got a meal, eats it. And then again, now that parasite has completed its life cycle and it can continue on in that cycle. What happens sometimes is you can either have a transport host. So for example, an insect may pick up the parasite out in the wild. So like here's some grass, right? So the possum passed out the parasite egg, the transport host, the insect picked it up on its legs, and then it got eaten by the intermediate host. Now the intermediate host has it, and the possum then eats the intermediate host and gets it back. Or sometimes what happens is it goes to an accidental host, or they wrote aberrant host in this picture, which means the same thing. So it went into a host that it's not supposed to go into. So some other species picked up this egg, and it's not supposed to be in this species. This species has not adapted to live with it the way that the grackle has adapted to live with it. And now this accidental host has more problems from it. And in Northern California, I don't know if it's still a problem, but I know it was reported several years ago that there was a particular species of Sarcocystis that some parrots were getting. And they were being an accidental host for it. And when they were getting it, you were having signs like neurologic disease, respiratory disease. If the bird the accidental host is able to survive the neurologic problems and the respiratory problems, because unfortunately some of them cannot, then it will go into the muscle and insist itself the way that it does in the grackle, and then has the potential to complete the life cycle. But the problem is the majority of them, when they're in this accidental host, because they are not adapted to be in them, they can cause a lot of disease and really serious problems. And I know several years ago, again, when it was being diagnosed in Northern California in some parrots, the thought was that the parrots were eating the transport hosts. So they were in birds that were outdoors in an aviary setting, and there was cockroaches that were able to get into the bird's enclosure, and the birds were thought to be eating them, and that's how they were picking up the eggs of that Sarcocystis organism. Now, because it can be so sudden when they develop signs from this and rapid progression, unfortunately, sometimes we don't even have the time to do diagnostics or do treatments. There are diagnostics we can do. There's serology testing. There are treatments that can be used for birds that we may be able to identify that have it, but sadly, sometimes by the time that these infections are diagnosed in birds, it is too late, and we are not able to do treatments for them. So the moral of the story with this one is don't let your birds necessarily be eating insects that are getting into anywhere, really. So, because it's a little bit more, unfortunately, a little bit more of a difficult one. But okay, what about fungal infections? With fungal infections, I don't have a lot of stuff to talk about necessarily fungal infections coming to our parrots from wildlife, which is a good thing, because you don't see a lot of spread of fungal organisms from wild individuals to captive individuals at all. Though we can see a particular fungal organism called histoplasmosis spread in pigeon feces, because pigeons can have that fungal organism in their poop, and like when their poop is out in the environment and it sits somewhere and it dries, the histoplasmosis organism can be present in it, and it could, in theory, like aerosolize, and animals could be coming into contact with it, or humans could come into contact with it, and you can get infections. It just doesn't happen very commonly. So, and again, it's not the pigeon necessarily that's the main problem, it's the poop that's the problem. And generally speaking, it's recommended to not be around animals' poop, no matter what species it is we are talking about. So the moral of the story with histoplasmosis is it doesn't really, like, just don't have your birds around other birds' poop, or any animal's poop is highly recommended for a variety of reasons. I put aspergillosis up here. Aspergillosis is a fungal organism. It does cause problems. It causes respiratory problems for the most part in our pet birds. However, it's typically not spread from wildlife. Aspergillosis is something that is ubiquitous in the environment, meaning it's like all over the place in the environment. Like I'm sure there probably is some spore of aspergillus in this room or on my skin. It's out there in the environment, and we have to live with it and deal with it. But and wild birds can get it. Wild birds come in for aspergillosis infections into a wildlife facility for care. But it's usually not a bird that has aspergillosis typically is not spreading it to another bird that has to give aspergillosis to another bird. Sorry, I said that a little weird. So fungal infections, the whole I guess thing to know about these is, yes, they're out there, but no, they're not typically a major problem in our pet birds getting them from wildlife. If our pet bird gets aspergillosis or another fungal infection, usually it's more that individual having some sort of problem and high level of exposure to fungal organisms, or being immunocompromised in some way that makes it so that they can't fight infection off. Okay, so we're going to go into viral then. There are several viruses out there in the world, but the two that I wanted to talk about are citizen beak and feather disease virus and avian influenza. So now, this is, again, a little bit unique to Arizona, but I bring it up because it seems like more places are having wild parrots be around where they wouldn't previously. California has lots of wild parrots, and I don't know how much something like this virus is going to be a problem, or not, but it is a problem here out in Arizona. PBFD is the short term or short name for it, but the longer name is citizen beak and feather disease virus, and that word citizen in it tells you it is a parrot virus. It's also called circovirus, is the broader viral category it falls into, and it's something that we usually are talking more about with pet parrot owners than I am talking with wildlife centers about citizen beak and feather disease virus. Because we know that parrots can get this particular virus. It is a parrot virus. It can be spread from one parrot to another. Certain species are more susceptible to it than others. And you may have a little bit of different signs, but generally the main sign is feather loss that happens with successive molting. It leads to immunosuppression. They can get damage to their beaks, their nails, because they're immunocompromised and having immunosuppression. They can get secondary infections. So the classic bird that gets this particular virus, again, is going to be a parrot, and you're going to be seeing feather loss that's going to get worse with each excessive molt. They can live with it for many years. Some of them don't, unfortunately. The thing that usually kills them is not the feather loss, it's the immunosuppression that they get. We can diagnose this particular virus easily, thankfully. It's just a PCR test. So if I have a bird that I'm concerned about it in, I take a blood sample, I send it off to a lab, and we can diagnose this particular virus. There isn't any specific treatment for citizen beak and feather disease virus. It's just supportive care. We just put birds on supportive care to give them, really a healthy environment. We try to really make sure there's very little access to disease, because it's the immunosuppression that can kill them with secondary infections as opposed to the virus so much itself. So again, the reason I'm bringing it up here in context of wildlife is because remember how I was saying we have our pet, or not our pet, our naturalized lovebird citizens out here in Arizona. Well, I mentioned they have chlamydia, but we also have citizen beak and feather disease virus in them, and it cycles in the population. So you'll have years where it's at really high levels and they're dying from it. And then because some of them die off, that knocks those numbers down. So now it's in a lower percentage of the population, but because it is an infectious disease, given time, it's just going to start to rise again in the population. And so we have these ups and downs where, unfortunately, some years we have these birds dying of citizen beak and feather and chlamydia, and having these die-offs. And so whenever I have a owner of a parrot who found a wild lovebird, I am absolutely telling them you have to keep that wild lovebird separate from your parrots. And it's very easy for people to see like these little lovebirds out in the wild and want to take care of them, and that's absolutely a good thing. We want to help all those different animals out there. We just have to be very cautious. If you have pet parrots, you do not want to take a wild parrot from the out in the wild and mix it with your pet parrot population, because you could potentially have something like this. And again, this is something that I see specific in Arizona. I just don't know how it's going to be a problem in other parts of the country and world where you have parrots that are, again, in places more and more that they're not necessarily supposed to be, but are adapting to and living with humans. So, it's something to be mindful of. Certainly in certain parts of the world or like parts of the country, of the US, you're not going to have this be a problem. If you're in Minnesota, I don't know many lovebirds out in the wild living in Minnesota, so you are not going to have to worry about this particular problem. But keep it in mind for places where people live. If you do happen to be somewhere where there's wild parrots, don't mix. And if you do want to mix them at some point, take the wild bird to a veterinarian, have it tested, check it out for infectious diseases, make sure that it isn't a carrier or something, because birds can carry illnesses, not show signs of them, and either break with them later or pass them on to somebody else. So infectious disease testing is important if you're bringing a new bird into the home. Okay, now what about avian influenza? And this is kind of a hot topic, and I'm sure people have been hearing more about this because of the recent events and changes with it, particularly with the high path influenza being found in dairy cattle, or the milk in milk produced by dairy cattle, and one person having developed conjunctivitis and found to be infected by this virus. But to back up, avian influenza includes a big group of viruses. So there's many types of influenza viruses. Avian influenza viruses are influenza A viruses, and then in the influenza A viruses, there's many different types, and there's high pathogenic and low pathogenic influenza viruses. The high pathogenic ones are the ones that we don't want to deal with. The high pathogenic ones, you can have a bird show sometimes like minimal signs to almost no signs and be dead from it. The low pathogenic ones, those cycle in the environment and change from year to year. Just like, we have our flu virus that is in human populations, and is a different one like every year, and you get a flu vaccination to like hopefully protect you from the one that's going to be happening this season, and usually it's the fall season, right, to like winter season that you're getting your vaccines for to be protected from. I mean, those same influenza viruses are low pathogenic influenza viruses that are cycling in wild bird populations. But the high pathogenic ones are the ones that are a little bit more problematic. They have potential to be causing sudden death and illness. I wrote down signs of avian influenza, such as respiratory signs, gastrointestinal signs, neurologic signs. Those are the signs that honestly sometimes you see more in the low pathogenic ones, where they can mount an immune response and recover. Sometimes in the high pathogenic ones, no signs whatsoever, they're just dead. So it can be really scary. And depending upon the species that is affected, it can have a high mortality rate. Most of our influenza viruses, when we're looking at mortality rates, it's really based off of what we know in chickens. So like when we say high pathogenic avian influenza, it means it's going to cause a high amount of death in chickens. What happens when that high pathogenic influenza gets into a blue and gold macaw? We don't know. We don't have that data. I can't tell you the rate of death of avian influenza, high pathogenic avian influenza in a macaw, because people look a little bit more at chicken stuff because of the way it affects our economy than they do other species of birds. But with this particular high pathogenic avian influenza outbreak that we've had, it started in 21, and normally, again, the influenza viruses kind of like die out. And then, next year there's a new one. This highly pathogenic avian influenza has not done that. Oddly, it has stayed around and it has been persistent, and it's caused mortalities in various different species. The species that we've seen a lot of high mortality in, unfortunately, with this particular one is raptors. And with the California condor, this is again that little picture of the baby who just turned a year old yesterday, whose mother passed away from influenza. When we were dealing with this particular outbreak happening in the California condors, it was only in Arizona that we like really were having problems. The other populations of California condors in like Oregon and California and Baja California, thankfully we're not having problems. But when we had it with the birds here in Arizona, the birds that were able to get into the facility for supportive care, we were having like a 50% death rate with them, you know, so that's high, especially when we're talking about an endangered species who doesn't have a lot of species out there, and so losing 50% is not desirable. But you know, you can do supportive care, which is what we were doing with these birds, just trying to help them through it, and some of them were pulling through. And in theory, this particular virus could pass over to our parrots. This particular virus, this highly pathogenic H5N1 influenza virus that's been out the last couple of years and causing all the recent issues and drama in the world, did affect some parrots early on, somewhere on the eastern side of the United States, but it really hasn't been a big problem for our parrots. Again, don't have your parrots around wild birds is the best thing I can tell people. You know, me as an avian veterinarian, one would think that, you know, I'm going to be a high risk, right? Because I am doing stuff with these wild birds. I was around these condors who had highly pathogenic avian influenza, and other patients that had highly pathogenic avian influenza. So one would recognize that I have the potential to have this virus on my hands, clothing, what have you, and be able to bring it home to my parrots and potentially spread it to my parrots. That's a risk, you know. And any of these diseases that I work with in wildlife, or any of the diseases I work with in the hospital here, like I have the potential to take this home to my animals, and I have to be mindful and cautious of that. But if we practice appropriate biosecurity, which involves, for me, working with these animals, I have to wear appropriate gloves, gowns, face masks, booties. I have to like have clothes that are specific to the place where I'm at when I'm working with them, and then I have to take those clothes off, and those have to go like into the wash right away and change into different clothes. I'm very mindful of like not having my clothing in when I've been around wildlife around my pet birds, and my pet birds have been fine. So I bring myself up as an example as someone who has literally been around this virus, and none of my birds have passed away from this virus. I have not transmitted this virus to my pet parrots. So I think people out there shouldn't worry so much that this virus is going to be a big problem for their pet parrots. Just be mindful to not have your pet parrots around wildlife for all the reasons we've already been talking about, but you can take them outside. They can enjoy outside. I like I said, I take my birds outside all the time. On my like weekends when I'm off of work, me and my birds are hanging out outside. They're outside, you know, a good probably 3 days a week that they're getting, you know, time outdoors. I think it's really important and helpful for their like mental stability and you know, seeing different things and getting exposure to natural sunlight. So you can do it, you just have to do it safely. Don't let them have exposure to other birds. Have them in a protected area that wild birds can't get to. Don't let them share food with wild birds. Don't let them drink water where wild birds have been drinking water, and clean off areas if wild birds are able to access the area where your birds are before you allow your birds back out there. So that's my talk about wildlife and our pet parrots. Does anybody in the last little bit here have any questions?
Okay, yeah, we do have a question. Just so if your bird flies out, goes outdoors, gets out, flies away, protocols when you do bring your bird back home, what do you do? Just assuming that, you know, it's been outside where wild birds have been for any amount of time. Is there, what protocols do you recommend?
I mean, part of it's going to depend on how long they've been out. Like if they've been out a very short period of time, say they got out and they were out for like an hour, your chances of them being exposed to something infectious is pretty low likelihood. Versus if your parrot's been out there for like 3 days, then your potential is a little bit higher. So when we have a little bit greater potential for there to be a problem and have had exposure to wild birds and maybe have the ability for an infectious disease to be picked up when you get them back. It's always good to, just isolate them first. Don't put them around with your other parrots if you have a multi-parrot home. Have them more in an isolated area, let them like relax, because the biggest thing probably that's the worst thing is really the stress of, oh my God, I was just out for the last several days and how much food and water did they have? Like, let them get inside, let them de-stress, access to food and water appropriately, and then call your vet and ask your vet to make an appointment for them, and keep them in isolation until the vet can see them. And probably things that may want to be done, depending upon, again, where you live, what sort of things might be out there. There might be some infectious diseases that your vet may want to check for. But it all depends on what's out there where you live. So like if I have somebody here who has a bird that's escaped, if I am worried that they potentially had access to like where lovebirds are, well, then maybe I do want to test them for chlamydia and just make sure that that's not a likely problem. But if they're somewhere where they really probably didn't have that access, then I may just want to do just a basic physical exam. They have their little quarantine for maybe a couple of weeks just to make sure that they're not showing any signs of illness or problems. And then after that period of time, they're okay to go back with, the rest of the flock. So it is going to be a little bit variable based on the individual, and, certainly something to talk about with your veterinarian.
Okay. All right. So Lori wants to know, this is a good question. Are hummingbirds a threat to parrots as far as diseases go? So if you have a hummingbird feeder up, are you?
Not, no, thankfully not a major threat. One of the things, there's actually a student at the Wildlife Center who's currently doing a study with like a tapeworm specific study with hummingbirds and finding what type of tapeworms they have. So, I mean, if a hummingbird has a tapeworm, in theory, could that they poop and pass that tapeworm to a pet parrot? Well, the parrot would have to have access to its feces, right? So and then they would have to ingest the feces to get the eggs of that tapeworm to get a problem. So I never heard of it being a problem. It's just, I'm thinking in my mind, like, how in theory could this be a problem? So I think it's probably a low likelihood of a hummingbird really being an issue for a pet parrot, but there's hummingbird poop around, hose it off, get rid of it.
All right. And then question about, can protease inhibitors be used to control the virus? So I think we're talking about the avian flu.
Influenza virus. Okay, so there is a medication called Tamiflu that I'm sure people have heard about because it's a human medication that's used to sort of block the viral replications in the body. And yes, it can be used. I will say it is a controversial medication to use in wildlife. That is something that's probably a lot more to talk about than just the last couple of minutes we have left. So the answer is yes, there's meds that can be used, but the longer answer is it's a little bit more complex than just yes, and we have to be aware that we can't use it in everybody.
Okay. I think this will be our last question if we have time. So are the common infections spread to pet birds through insect bites? So yeah, insect bites.
Oh,
and
yeah.
Mosquitoes, I'm thinking, or like fleas or.
Yeah. We don't see, thankfully, a lot of that being a problem because when we're talking about parasites, because it's mostly parasites that are going to be transmitted through bug bites, mosquitoes, that sort of thing. And they have to have their appropriate life cycle. Like I know I was talking about the sarcocysts, I'm sure some people's eyes rolled in the back of the head as I was talking about that because it's this complex, long life cycle. And if you go to this side, it's going to cause this. If you go over here, it's going to do that. With parasites, that's very typical that there is this long life cycle, and it often involves the definitive host and the intermediate host, and then maybe your accidental host. You have to typically have that appropriate intermediate host to transmit some of those things. And some of the intermediate hosts that would be the appropriate intermediate host to transmit a disease to a parrot don't live Here in the US, they're more in places where this bird should be, you know, where if it's a wild parrot in the wild, okay, there, you know, down in South America where she's from, I would have to worry about those things more. Hemoproteus, leukocytozoan, those are some parasites that are known to be transmitted by biting insects. But I don't have to worry about them as much up here because we don't have the appropriate intermediate host to transmit that particular parasite.
Okay. Okay. And I'm sorry, you have time for I swear, promise, final question. So is a weekly 10% bleach solution effective cleaner for outdoor bird baths, also on the ground under the feeders? So can you use like a 10% bleach solution to clean your outdoor bird baths and on the ground under the feeders?
It's not a bad idea to do at all. Now, bleach isn't going to kill everything because different infections are going to be susceptible to different different cleaning agents, but bleach is a good one to use. It's easy for people to have access to. It has the potential to be harmful, but less harmful than some other disinfectants that are out there. So for regular use in like around a bird bath and around like the area where maybe the feeders are, yes, that is perfectly acceptable to use as a cleaner to just get rid of stuff.
Okay, and probably a reminder that you do need to clean your wild bird feeders and water sources so that you keep them safe from disease, right?
Absolutely.
And how often should you clean those? Like if you're feeding a wild bird, you have a feeder, if you're offering like say seed or.
Yeah, that's a great question. I don't know that we have a like perfect answer on that, but like if people do want to do it on a weekly basis, great, go for it. Like with my feeders, because like I said, I feed birds and I also have a bird bath too. I like intermittently have food in there or intermittently have water in there. So I'm actually trying to like make it be sometimes that I'm not having birds come by in an effort to like have those things dry out and like not be a access point for birds to be communally feeding and all that sort of stuff. So like I will like put food out and then maybe I won't put food out for like, I don't know, a month, and I've cleaned it, it'll sit there for a while and then I'll put food out again. So I don't know that there's a perfect answer to that, but if people want to clean on a weekly basis, go for it.
Okay. Wow. Okay. I got to announce. So thank you. And for those extra, I know your time is precious. And also, I mean, just the thought that the PowerPoint is just phenomenal. And I know you spend time putting that together. So that's like the behind the scenes that you do prepping for these. So totally appreciate your time on this, Dr. Lamb. I got to announce today's winner, and that's gonna we got our giveaway for the tropical fruit newtberries. That is gonna go out to Ann Morris. Congratulations, Ann. And we're also gonna send out a another Lafeber product of your bird's choice. So I hope that makes your weekend. We'll contact you, get that sent out. Next Friday, just a sneak preview, we're gonna be on with Lisa. Lisa Moto is gonna be back, and she's gonna do part 2 of the retreat for the wellness retreat, the Phoenix Landing wellness retreat. So we'll do a day 2 recap. And on that note, wow, again, I mean, I have to go, these slides are so invaluable. Like there's so much good information on those and the infographics and it's really good. You do a really good job with that. So
I'm happy to provide.
All right. So, all right, you guys, I hope you can maybe look out your wild birds a little bit different eye when you go into this weekend here, kind of like a little different mindset on how to protect your flock. And on that note, guys, I'm gonna wish everyone a wonderful weekend. Thank you for joining us, Dr. Lamb, once again. Home run out of the park info, just love it. All these great thanks to you. So
all right, thank you.
Have a great weekend. All the best to you and your flock. Till next time. Bye.
Bye.